Now we're going to see the synthesis of collagen. We begin on the endoplasmic reticulum. So this is the cell, this is the endoplasmic reticulum, or this, and we are doing a zoom. First, we have the collagen is a protein that is going to be synthesized on the endoplasmic reticulum. So remember that here we have the nucleus. After the messenger RNA goes out of the nucleus, then the translation begins, and here we have ribosomes. But because it is going to be translated on the endoplasmic reticulum, in the membrane of the endoplasmic reticulum, then this endoplasmic reticulum is this ribosome with the messenger RNA are going to stuck here. Now they go here because the protein has the first signal that is like saying that goes here. Now that signal contains only hydrophobic amino acids, like 15, something like that, and then it will be cleared off. But we first use that, and this promotes that the ribosome and the messenger RNA goes into the endoplasmic reticulum. So the first molecule or protein that we have is the Prepro Collagen or Prepro alpha chain. We have one alpha chain, and this here with this hydrophobic signal. This is the first step. The second step would be removal of this hydrophobic. So here we have the removal, and this is now the pro alpha chain. Then we have the hydroxylation of lysine and proline. For this we need vitamin C as a cofactor. Patients that don't have or that have vitamin C deficiency, I don't know if I say vitamin D, but it's vitamin C. If patients have vitamin C deficiency, they have scurvy, and it's the bleeding gums, the corkscrew appearance of the colorectal hairs. Alright, so patients who have a history of eating, for example, just tea and toast, or but no citric acid nor anything, no fruit, for example, no lemon and no orange. Alright, so we have the hydroxylation of lysine and proline. Then the fourth step is the glycosylation of the hydroxylysyl residues. This includes the sulfate bonds and hydrogen bonds. Next we have, and here we already have the procollagen. This is procollagen, because then it's going to undergo exocytosis, then it's coming out of the cell, so exocytosis. And in the fifth step we have removal of some disulfide terminals, and now procollagen converts into tropocollagen, that is a insoluble fibers. Step 6 is the stabilization. So here now we have the lysyl oxidase, that on this reaction, not specifically in this reaction, but in order to do this we need copper. So patients with a mutation on the transporter of copper and things like that, we'll talk about this later, but this is called Menkes disease. And in Menkes disease the problem is exactly at this point on the collagen synthesis. So this now stabilize the collagen, so stabilization of collagen. Then we will have that three chains of tropocollagen will bind right? And so this would be called a fibrils, and then many fibrils are going to join, and we have the collagen fibers. So one is fibril and other is fibril. So the first step is the Prepro Collagen. That is the collagen or the Pro Collagen, but with the well, not just Pro Collagen because we need the post-translational modification, but well, it is the protein with these amino acids that are hydrophobic. The next step is the Pro Collagen, that is when we remove that chain. Next, we have the hydroxylation of proline residues and lysine residues. And for this we need vitamin C. If not, we would have scurvy. Then we have the glycosylation of the hydroxylysine residues, that is on the hydrogen bonds and the sulfide bonds. Then exocytosis, and here the procollagen passes to tropocollagen. Tropocollagen is the unsoluble fibers or fibrils, and then the lysyl oxidase is going to oxidize or cross-link. Now this cross-link is on the lysine residues, and here actually is forming the cross-link with another fibril. So is this step we are doing the fibrils, and then many of these like a couple of 3 fibrils are joining, and we have the fibers. Now the composition of the collagen is mainly composed of glycine, and then XY being proline and lysine most of the times, but every 3 amino acids, every 4 amino acids we have glycine, and this permits the turnaround of the alpha second structure of the secondary structure of the protein. Problems before the exocytosis of the procollagen molecules leads to osteogenesis imperfecta. We have type 1 and type 2. The type 2 is when we are more advanced on the chain, like on the glycosylation, and here patients die on utero. In the other, the patients survive and they have the fragile bones, sometimes dentiogenesis imperfecta, that is the abnormal form or shape of the teeth, and they have a blue sclera because the white part that is the sclera is not very thick because of the defect on the collagen, and so the veins are exposed, and that looks blue. Patients could also have problems like conductive hearing loss or things like that. And in Menkes disease, that is here on the glycosylation, on the lysyl oxidase part, patients present with short hair, hypotonia, increased risk of cerebral aneurysm, but the classical presentation is that kinky hair and the abnormal on the collagen problems. And the Menkes disease is mutation on the gene ATP7A, that is the mutation that leads to Menkes disease. The ATP7B is seen on Wilson disease. ATP7A is Menkes disease.